Have you ever wondered what citalopram, commonly known as Celexa, is used for and its side effects? This question is often at the forefront of many minds, particularly those navigating the broad and intricate world of psychiatric medications. Citalopram, or as we'll refer to it from here on out, Celexa, is an antidepressant. But it's not just any antidepressant, it falls into a specific category of drugs known as selective serotonin reuptake inhibitors, or SSRIs for short. These are fancy terms, but what do they mean? In simple terms, SSRIs like Celexa work by increasing the levels of serotonin in your brain, which can help improve your mood and reduce feelings of anxiety. Understanding the general concept of Celexa is the first step towards fully grasping its potential benefits and risks. Now that we've established what citalopram is, let's delve into its uses. So you might be asking, what is citalopram used for? Citalopram, also known by its brand name Celexa, is a medication that falls under the category of selective serotonin reuptake inhibitors, or SSRIs for short. This impressive-sounding name essentially means that it's a type of drug designed to help balance the levels of serotonin in the brain. Now, serotonin is a neurotransmitter, a kind of chemical messenger that helps regulate a lot of our bodily functions, including our mood. Imbalances in serotonin are often linked to mental health conditions, and that's where citalopram comes in. The primary use of citalopram is to treat depression, but depression is a complex condition, and it can present itself in a lot of different ways. Some people might experience a persistent feeling of sadness or a lack of interest in things they used to enjoy. Others might struggle with feelings of worthlessness or guilt, or even have thoughts about death or suicide. By helping to balance serotonin levels, citalopram can alleviate these symptoms and improve the overall mood. But that's not all. Citalopram is also used to treat a range of other mental health conditions. These include panic disorder, a condition characterized by sudden and repeated attacks of fear, obsessive-compulsive disorder, or OCD, which involves unwanted intrusive thoughts and compulsive behaviors, and various anxiety disorders, which can cause excessive worry, fear, or nervousness. Citalopram can even be used to treat post-traumatic stress disorder, or PTSD. This is a condition that can develop after a person has been through a traumatic event, and it can cause flashbacks, nightmares, and severe anxiety. By helping to regulate serotonin levels, citalopram can help to alleviate these symptoms and improve overall mental well-being. In a nutshell, citalopram is a versatile medication that can be used to treat a range of mental health conditions. But like all medications, it's not without its potential side effects. Now that we've covered the uses of citalopram, it's important to consider the side effects this medication may have. As with any medication, citalopram does come with its share of side effects. Now, it's important to remember that not everyone will experience these side effects, and some may even experience them to a lesser or greater degree. Our bodies are unique, and how we react to medication can be as well. That said, some of the more common side effects of citalopram include nausea, dry mouth, and drowsiness. Nausea can be an uncomfortable feeling in the stomach, often leading to an urge to vomit. Dry mouth, on the other hand, is exactly what it sounds like. Your mouth might feel parched, which can make swallowing a bit of a challenge. And then we have drowsiness. This can make you feel tired and lethargic, possibly impacting your day-to-day activities. While these common side effects might be inconvenient, they're generally not dangerous. However, there are also severe side effects associated with citalopram that require immediate medical attention. One such side effect is an irregular heartbeat. This is often characterized by a heartbeat that's too fast, too slow, or irregular. It's a serious condition that can lead to other heart-related complications if not addressed promptly. Another severe side effect is serotonin syndrome. This is a potentially life-threatening condition that can occur with the use of certain medications, such as citalopram. Symptoms can range from shivering and diarrhea to muscle rigidity, fever, and seizures. Lastly, we must touch on the topic of suicidal thoughts. While it's a difficult subject to discuss, it's crucial to acknowledge that some people taking citalopram have reported having suicidal thoughts, especially those under 25 years of age. If you or someone you know is experiencing these thoughts while taking citalopram, reach out to a healthcare provider immediately. The importance of contacting a healthcare provider if any of these side effects occur cannot be overstated. They can provide guidance, adjust your medication, or take necessary steps to ensure your safety. Remember, this list of side effects is not exhaustive, and your experience with citalopram may differ. This is why it's so important to communicate openly with your healthcare provider about what you're experiencing. They can help you navigate any potential side effects and determine if citalopram is the right medication for you. It's essential to be aware of these side effects when taking citalopram, but remember, every individual's reaction to medication varies. Let's address some of the frequently asked questions about citalopram. One question that often comes up is, how long does it take for citalopram to work? Typically, it takes about 1 to 4 weeks for individuals to experience noticeable improvements in their symptoms. However, it's important to remember that everyone is unique and response times can vary. Some patients may feel better sooner while others might take a bit longer. It's crucial to continue taking the medication as prescribed, even if you don't feel better right away. Now on to the next question, is it safe to drink alcohol while taking citalopram? The short answer is no. Alcohol can increase the intensity of certain side effects associated with citalopram, such as drowsiness and dizziness. It can also interfere with the effectiveness of the medication. Therefore, it's generally recommended to avoid alcohol while you're on this treatment. Another common question is, what should I do if I miss a dose of citalopram? If you realize you've missed a dose close to the time you usually take it, go ahead and take it. However, if it's closer to the time of your next dose, skip the missed one. It's important not to double up on doses, as this can increase your risk of side effects. Yet another question that comes up is, can I stop taking citalopram if I feel better? It's crucial to understand that stopping citalopram abruptly can lead to withdrawal symptoms. Even if you're feeling better, it's important not to discontinue the medication without consulting your healthcare provider. They can guide you on how to safely taper off the drug if it's appropriate for your situation. Lastly, does citalopram interact with other medications? Yes, citalopram can interact with several other drugs, leading to increased side effects or decreased effectiveness. Therefore, it's vital to inform your healthcare provider about any other medications, supplements, or over-the-counter drugs you're currently taking. Remember, if you have more specific or personal questions about citalopram, it's always best to consult with your healthcare provider. They can provide the most accurate information based on your unique health situation and history. Let's summarize what we've learned about citalopram, also known as Celexa, today. Firstly, we delved into understanding what citalopram is. It's an antidepressant in the selective serotonin reuptake inhibitor, or SSRI class. It's used to balance the levels of serotonin, a natural substance in the brain that helps maintain mental balance. We then moved on to the uses of citalopram. It's primarily used to treat depression, but it's also found to be effective in managing panic disorder, obsessive-compulsive disorder, anxiety disorders, post-traumatic stress disorder, and even premenstrual dysphoric disorder. However, it's important to remember that citalopram does not cure these conditions, but helps to manage their symptoms. We also shed light on the potential side effects of citalopram. Most common ones include nausea, dry mouth, excessive sweating, and fatigue. Some serious but less common side effects include changes in sexual desire, easy bruising or bleeding, and unusual weight loss. Additionally, it can cause serotonin syndrome, a potentially life-threatening condition if left untreated. While discussing these side effects, we emphasize the importance of consulting with your healthcare provider if you experience any discomfort or abnormalities. Remember, each individual may react differently to medication, and what may be a common side effect for one might be unusual for another. Lastly, we addressed some frequently asked questions about citalopram, clarifying doubts about its use during pregnancy, its interaction with other drugs, and the appropriate way to discontinue its use. In conclusion, citalopram is a widely used and effective psychiatric medication, but like all medications, it should be used responsibly under the guidance of a healthcare provider. Thank you for joining us in this comprehensive guide to citalopram. Remember, knowledge is the first step to managing your health.